For those of you online, you can hear and you can see the slides, but we're having some technical difficulties seeing the room, so apologies about that. But we're excited to have our own Tasha Perdue here with us today for research. So turn it over to you.
Great. Well, thanks everyone. I really appreciate your time. I know we're at that point in the semester. I feel like we're all juggling so many things, so appreciate you making time amidst all that. Those of you that know me know that I really like cats, so I wanted to do a quick check-in on a scale of today.
On a scale of cat.
I was hovering between a 4 and a 5, I think. Do we have any ones? Anybody have a 1 today?
Actually, that one's speaking to me.
Well, I'm going to talk to you later and get your secrets. So I'm hoping I don't leave any of you at a 6 today. I do have a few disclosures. So the first, this project was supported by an NIJ award. So pretty much anything I say today does not represent those views of the Department of Justice. So just make that quick disclosure. Then for a little non-serious disclosure, I have had a lot of coffee this morning. I have a teething 1-year-old. That's a picture of him pre-teething, just to remember what that was like. So sleep has been a little more sporadic, so a lot of coffee. So with that, if I talk a little faster, just let me know. I can slow down. I do also have an ambitious slide deck, so let me know. I can put on the brakes a little. So I'm going to talk a little bit about policy context in which drug courts are situated, an overview of the parent study, some of the working papers in development, and then plans for future directions and discussion at the end. So I'm going to start with a little bit of the evolution of the quote-unquote war on drugs, so what we've seen. And for any of you, I don't know if any of you are familiar, this was a commercial actually from the 80s. And this was played, I used to recite this in the car with my mom. And it was, this is your brain, this is drugs, this is your brain on drugs, any questions? So we have seen, along the same time we've seen sort of drug policy change, we've also seen messaging change throughout the years. And we could do a whole nother presentation on sort of what the messaging towards substance uses look like from a broader social perspective. Can't get into that today, but always like to start with that sort of grounding that in my own sort of early exposure to initiatives towards substance use. So some of the early foundations, we may immediately think, when we think about the war on drugs, we may immediately go to the Nixon era. However, the early foundations started much earlier in the country. We did see in the 1800s laws start to be introduced on a state-by-state basis. And these were really to regulate opium dens that we were seeing emerging here in the US. And this wasn't relegated to the US, however. We saw a lot, particularly on the West Coast. We did see, if any of you have been to Vancouver or plan to go, there's some tours you can do of the city. They also talk about opium dens and sort of those initiatives related to that. On the federal level, we did start to see more of a federal initiative with the Food and Drug Act, and this required any sort of companies that had products that they were selling that had alcohol, heroin, cocaine in them to label those products as having those. We did see more of a federal push towards non-medical use of opium, so that Smoking Opium Exclusion Act in 1909. And then the Harrison Act. So we saw a lot of early initiatives really focused on taxation. So the Harrison Act was really focused on taxing and regulating that distribution of drugs here in the US, and followed by the Marijuana Tax Act. So a lot of early initiatives really related to restricting the non-medical use as well as more taxation related. That is actually an ad for a screening of doped youth. That's actually another name for Reefer Madness. You may have heard of that. So this was an very early film related to the perils and dangers of drug use. So again, just another nod to sort of how the media has also, in our sort of social, how we talk about this, has influenced drug policy. So really, when we think of the start of the war on drugs, although we had sort of those initial foundations in the late 1800s, early 1900s, really started under the Nixon administration. And this was really spurred by the 1970 Controlled Substances Act. And this was really propelled because we had this emerging counterculture in the 1960s here in the US. And with that, there was drug use associated with that. So marijuana, heroin, there were certain populations also associated with that use. So this was the first really large federal drug policy under which the possession, use, distribution of certain substances was regulated. And the responsibility for enforcement was under one initial sort of agency, then moved to the Drug Enforcement Administration, the DEA. You may have heard of that. talked about when we talk about drug interdiction here in the US. That was formed in 1973. Interestingly enough, the majority of funding in the early 70s actually went to treatment. We did see a shift, treatment rather than enforcement. However, we saw a shift in the mid to late 70s towards away from treatment into more enforcement of issues related to substance use. It also classified drugs into 5 schedules. So this was classified into schedules based on perceived benefits and levels of potential for abuse. And this was actually driven by a lot of fear and stigma rather than, and less by science, this scheduling. This was followed by the 1971 Nixon officially declared drug use public enemy #1. So we're seeing a lot of more punitive approaches towards substance use. This is the Drug Scheduling Act. Apologies, it is a little small, but just to give you an idea of what the schedule looks like, so 1 through 5. Schedule 1 are those, is the most severe schedule. So these are drugs that are thought to have no currently accepted medical use. They are the most dangerous, and they have potentially severe psychological or physical dependence associated with them. So Schedule 1, most severe, to Schedule 5. These are drugs with the lowest potential of abuse. These are things that aren't quite over the counter, but you may not need a physician prescription to obtain. So you may go to your pharmacist and get some sort of cough medicine, but maybe they need to see your ID. They need to monitor it. They need to enter into a system. There's more regulation over this. Drugs can change schedules, so that's something else. It is a more intensive process, so if a drug is in one schedule, it can go to another. So I listed 6 drugs on the right. Of those, 3 drugs are currently in Schedule 1, so the most severe drug category. Any guesses on which 3 of those are in Schedule 1? Heroin? Heroin?
Cocaine?
And one more. Fentanyl. Oops. It's actually, I had an animation that is not working. If it was, it would be cool. You would see the ones disappear. But it's actually heroin, LSD, and marijuana. Those are the currently Schedule 1 drugs. Any surprising?
Yeah, marijuana. What?
Yeah. Yeah, so there are, you can see the list of all the schedules, which drugs fall under those schedules. So this also, the restrictions on Schedule 1 can also impact research. So it's much more difficult to research, and especially if we want to look at therapeutic benefits of some of these. There are additional permissions that you have to get and procedures that you have to go through to actually be able to research this. So that can limit our knowledge advancement in that area.
Yeah, Tasha, this scheduling, which year this was done?
In the 70s.
Yeah, that's probably why. Yeah.
And there is a movement. So I do want to say the Drug Enforcement and Policy Center has done a lot of work in the cannabis and marijuana policy space. So if you want to go to their website, they have a lot of resources there, and they're actually following. So there is a push. Biden actually asked them to reevaluate the scheduling of marijuana being Schedule 1. They've started it. They've started the process to kind of revisit and maybe move it to a lower schedule. I think it's proposed to be moved to Schedule 2. So there is that initiative. I think it's kind of still it's under review, discussion, so we'll see if it actually moves and what that looks like.
So there is different scheduling in other countries, though, right?
Yeah, this is specific to the U.S. Yeah, the U.S. scheduling. So, and then this can also dictate, so not only what research can be done, it also dictates what enforcement looks like, sort of penalties associated with these substances as well. So, moving forward, we saw under the Carter administration not much prioritization in this area. So the next major federal legislation related to drug policy was in the Reagan administration. And this was really when we saw an escalation of the war on drugs. And this was really through the Anti-Drug Abuse Act of 1986. And a lot of money to fight the war on drugs. It changed the system of supervised release, which that's parole and probation. So if individuals are on probation, they are in probation and maybe in lieu of a jail sentence. They still have to maintain contact with the system, meet requirements, but it's less punitive. Or parole, they are released from prison early and they still have to maintain that contact. It changed that from more rehabilitation to more punitive. It established new mandatory minimum prison sentences related for certain drug offenses. So this really takes that judicial discretion piece away because there is this mandatory minimum that individuals have to be sentenced. It also implemented the 100-to-1 sentencing ratio for crack cocaine and powder cocaine. So pharmacologically, crack cocaine and powder cocaine are the same thing. Powder cocaine is powder. Crack cocaine has been mixed with something to rock it up. So pharmacologically the same. There were differences in populations who were using these substances, and that's thought why this was actually pushed forward. So this mandatory minimum was given of 5 years for 5 grams of crack compared to 500 grams of powder cocaine. So just the sentencing disparity. And with this, we saw an increase in the number of people incarcerated for nonviolent drug offenses. So we had about 40,000 individuals in 1980. That went to over 400,000 in 1997. So this you've heard of this impact on war on drugs has had on mass incarceration. This is it. We also saw a change in anti-drug spending. So this shows the top row, or the top line shows efforts for supply reduction. So we can think of drug use as supply and demand. So supply are those dealers, the traffickers, and then we can think of demand as the people using substances. So efforts or funds spent towards the supply reduction, so that's law enforcement and interdiction is the top line, and then the demand reduction is the bottom line. We can see in the 80s, they're pretty equal, but we see they start to spread. They're both sort of increasing, but we see the amount spent on supply reduction, law enforcement increases exponentially. And then we see the resulting increase throughout into the year 2000. So some other things happened between then and 2016. Due to time, I can't go into all of them. We did see the crime bill under the Clinton administration. That was also very punitive towards substance use, led to more mass incarceration. We did see some changes in the sentencing ratio. It has been reduced from 100 to 1 to 18 to 1 now. Still a little disparity there, but a little closer. The next major piece of legislation was in response to the overdose crisis that we were seeing here in the US. So this is a whole other talk as well. Just the policy decisions that were related to the emergence of prescription opioids into heroin and into fentanyl. So this sort of multi-phase opioid epidemic that we've seen. And this is on the right, just the increase in drug overdose rates that we've seen in the US. So we have seen a steady climb from 1999 throughout into 2023. So those years listed. So in response to that, we had the Comprehensive Addiction and Recovery Act. And this was really to recognize addiction as a public health issue. And this authorized more than $181 million in new federal funding each year to address the opioid crisis. It also increased resources for evidence-based treatment. So this was for individuals with substance use disorder. So these could be things like medically assisted treatment, MAT, or more commonly known as medication for opioid use disorder now. So things like methadone, Suboxone, buprenorphine, the injectable Vivitrol that we have now. And it also supported access to drug courts and other treatment. So treatment alternatives to incarceration. So it increased federal funding, more supports for community-based services, and a focus on building those collaborations between the criminal justice system and other public and health providers. Jill?
This might be a dumb question, but is it easier to overdose on opioids and other drugs? Is that, like, I'm just like looking at this increase. Is it a matter of the kind of drug that people are using?
Yes, yeah, definitely. So, and during the initial, it's talked about in waves. So the first wave of the overdose crisis was driven largely by prescription pills. One thing, you can't overdose on prescription pills, but each time you get a pill, you know what dosage is there. It's very regulated. We did see this sort of movement to regulate. So we saw prescription drug monitoring programs increase. We saw physicians just cut people off who had been on prescription pills for years. And once they were, even if they knew they were dependent, they were just kind of, stopping all medication. I've had people describe withdrawal to me. It's like the worst. They said it's the worst flu times 100 that you've ever had. So individuals were then would go out to heroin. We also saw an increase in the heroin market. So we saw a reduced availability of prescription pills, increase in heroin, and then we saw the emergence of fentanyl. So that's when we really saw the uptick in really 2016, 2017. We saw fentanyl hit the market, and this was not supply driven. So this was not driven by people wanting fentanyl. This was just starting to get mixed into the supply. So this was very much a demand, a dealer-led thing, and they didn't know at the time what really fentanyl was. This led to a lot of overdoses. So that's why we've kind of seen within the waves, more regulated supply, still get overdose, heroin a little less potent, and then fentanyl, once that hit the markets, it was really raised risk exponentially. So with this access to drug courts didn't start in 2016, so this increased access, but we've had drug courts here in the US. So the first drug court started in 1989 in Miami-Dade County, Florida. And this was also in response to the crack cocaine epidemic. So that sort of the Reagan administration push was also sort of in response to the crack cocaine epidemic. This response also emerged, but it was on the local level. And they, instead of moving towards more punitive methods, wanted to divert individuals with nonviolent offenses from incarceration into more treatment and supervision. And with that, courts use a combination of the carrot and stick approach. So they use the incentives and they use sanctions as well for individuals within these programs. So individuals have to meet certain requirements. There's phasing that's involved in the programs for them to be able to complete this. On the federal level, we saw funding. The first round of grants from the Bureau of Justice Assistance was administered in 1995. One thing that I've learned is if you want to increase the uptake of interventions, provide money for it. So this was actually very effective. So because these are costly programs to run. These are very time-intensive, resource-intensive programs. And then related to that, we saw the expansion throughout the U.S. So currently in the U.S., we have over 4,000 treatment. So I'm going to moving from drug courts to treatment courts more broadly. So treatment courts encompass adult drug courts, juvenile courts, family courts, as well as mental health or veteran-specific courts. So there's different courts for different populations. So we have over 4,000 here in the U.S. And in Ohio specifically, we have 245. So, and that's treatment courts in total.
So do we have the most of any state?
Close. We are in the top 3. So Hamilton County here in Ohio created the first drug court in 1995. We actually had the opportunity to visit and sit in. It was interesting, the first drug court and the only continuously operating. They operate every day of the week. We also saw broader implementation available through state legislation changes. So Ohio Senate Bill 1 in Senate Bill 2 in 1996 was allowed the ability to grant probation for specific drug offenses, so that expanded who could qualify for these versus incarceration. And then we have the 2000 Intervention in lieu of Conviction statute. So this was a way for individuals to receive treatment, for them to be able to qualify for treatment in lieu of that sort of guilty plea and being incarcerated. So Ohio has the third most treatment courts. We have 106 adult drug court dockets. Any guesses on the 2 states above us with more treatment courts? California? Close. New York. California, New York. So if we think about population-wise, however, Ohio has a disproportionate amount of drug courts, considering our population in comparison to these other areas.
One of the other tabs was alcohol. Was there a precursor in growth of alcohol-related, or is that respond after? So when you look at adoption in alcohol courts.
Yeah. So some areas have that we've observed. We have specific sort of like alcohol-related courts. Some have combined, so they just call them recovery courts.
Oh.
So yeah. So I think we've seen
diversion programs are different in alcohol.
These are specific, yeah, so that would be like a alcohol, there's like diversion programs. This is actually like a treatment. They have to be in the program for like 18 months to 2 years. Yeah, these are a little different than maybe some of like the other diversion, like for underage drinking, for example, that's like a diversion program, yeah.
Are these courts at the county level? So 106 would imply more than the number of counties we have.
Yeah, so they're different. So there can be some like felony courts. There's some in the common pleas courts. There's also municipal level courts. So there's different courts in different levels. Yeah. Some counties have both. Some have one. Yeah. And some have multiple courts within the same county and the same we visited some counties that had 2 municipal courts, municipal adult drug courts, just 2 different judges operating them. So that would count as 2 drug courts. Yeah.
I always thought it was the Franklin County one, so Hamilton was earlier.
Yeah. Summit County was an early adopter as well in Akron. Yeah.
Just an observation. It's kind of interesting that, in Ohio, things were going in the opposite direction than, the crime bill and everything that was happening at the federal level, right? One was much more punitive, the other one is, yeah.
Yeah, that's what I think, yeah, we see these
It's just an
divergences,
opposite.
yeah.
That's a long time ago.
But it's just
As we all
interesting.
moved here and then
Yes,
what
yes.
happened?
It's just interesting, right?
Yeah, I think that it highlights the sort of divergence in the state and local
Yeah,
approaches.
yeah,
I mean,
yeah,
when we had the sort of uptick in the war on drugs in Miami and in Florida, they were like, we're gonna try something less punitive here, so,
Yeah.
yeah. So that brings us to the current study that I'll be discussing today. So this is part of a larger collaborative work with Dr. Sinead Lindsay, Dr. Alex Fraga. This actually was conceptualized during my first semester here in 2021. I guess that's 4 years ago. It went fast. And Alex and I were talking about, she was looking at the Supreme Court data, and the Supreme Court certifies drug courts here in this state. So courts have to go through a process, they have to meet certain requirements, and then they get certified. And one, they get funding. So you're eligible for funding if you're certified, but it's also, they want to make sure that they're adhering to the best practices and adhering to what the Supreme Court sets forth as those guidelines. So she was looking at the data. So all drug treatment courts provide data to the Supreme Court on who's participating, what that looks like. And she noted it looked like there were differences in who was participating in the court. So it led us to the broader question, what might be causing these differences, and especially differences according to race. So that, who was actually participating in treatment courts in Ohio. So concurrently at the same time, there was a funding announcement through the NIJ. This seemed like a perfect alignment. So we said, let's go for it. And we brought in Sade and just to help fill in some of the expertise. And we are all in charge of a different phase of the project. So this is a 3-phase study. Phase 1 and 2 is more of the admin data. I can't speak as much to that, but I can provide an overview. We have the Supreme Court data, which we're looking at, as well as we have 20 years of sentencing data. So we have both municipal data as well as the felony data that we can link in Franklin County across 20 years, so we can also see before and after implementation of drug courts. So Sade is leading an interrupted time series analysis to see what this has looked like pre and post implementation of drug courts. Alex is looking at more following case progression we can follow an individual from municipal court into felony court and seeing what that progression looks like. I'm leading the qualitative portion, phase 3. And with that, we have been conducting observations and interviews with courts around the state. So we have 2 working papers I'm going to be discussing today and looking forward to feedback on those. So this is ongoing. We're still in the process of collecting data, so I'm happy to come back after we have everything completed too to share final results. I also want to highlight the core, some of the core study team for the qualitative side. We also have had on the quantitative side, I'd be remiss to not mention, Becca has helped quite a bit with the phase 1 and phase 2 and admin data and CU, also assisted greatly with the project. So this is my qual group. So Lydia and Aditi are both, I'll call them out, are both here today. And then we have Dexter as well in DPC. So first today we're going to be talking about barriers in admission to drug court. So look a little bit at the literature, methods, some of the preliminary results, and then limitations. So really within this policy context, this is what's driving our sort of research question, our approach. These policy efforts have moved more away from a criminalization model to more treatment-based approaches for drug use, largely spurred by the overdose crisis, spurring individuals to view addiction as a disease. And although there has been this shift in recent years, the criminal justice system continues to be this primary point of contact for individuals. And this could be a primary point of contact for them to be linked with more criminalized approaches, or it could be a point for them to be referred more to treatment and services. Drug courts, what do we know about them? Research has shown that they result in lower recidivism, so that individuals coming back into the system, reduction in future drug use, they have increased and better employment and income outcomes, and then overall individual and family level improvement. So even among our interviews, participants talk about, the impacts aren't just on the participants here, it's also family level impacts as well. Most of the participants have children that we've talked to. We always, ask, what would you estimate the number of individuals with children, and most of them do have children. However, this eligibility criteria and race-based differences can lower drug court referrals, take-up and completion, especially among defendants of color. Gaps in research. The existing research into any differences in drug court are predominantly quantitative. So it offers us limited insight into how and why differences persist. Most studies focus on outcomes. So things like graduation and recidivism, unless fewer examine these sort of earlier stage decisions, so that admittance and referral process. And then quantitative studies show demographic differences in admittance. We really need that qualitative research to understand the processes by which these differences occur. So the overarching research questions: how do stakeholders perceive differences? What do they identify as contributing to these? And what solutions or strategies do they propose? This is, again, is an ongoing study. We have visited 16 drug courts in 11 different counties here in Ohio. We have conducted interviews with 39 stakeholders. And we have, working with Lydia and Aditi, we met on a weekly basis for the coding. So we started with some deductive. We started with the interview script for coding. And then we moved into more inductive coding once we familiarized ourselves with the transcripts. We each coded a series of transcripts independently, came to discussed any differences, and then resolved those differences. So we have a code book that we're pretty comfortable with. We know it may change as we interview more individuals in rural regions. We know that there may be some things that is not captured in that initial code book. This has been a very iterative and reflexive process coming back. I think just sort of sometimes agonizing over what to code something. So, and looking at the scope, so we have been all around the state. I think Ohio provides a unique opportunity. We have these distinct geographic regions here, and often we combine, something I'm really excited about, often we combine rural regions together, but we have rural non-Appalachian, we have rural Appalachian regions here in the state. Those experiences can look very different depending on where individuals are. So, an individual in Scioto County may look very different from someone in Seneca County. There may still be, barriers, but it may be, exacerbated in those Appalachian areas. So we've been to, again, around this day, I think Aditi and Lydia maybe can talk about my music choices, maybe questionable, hopefully not my driving. But we do have some other observations planned, and we're really targeting those other areas. So we do have a primarily metropolitan focus currently. So among individuals we've talked to, the majority of them are white females. Most in sort of more of the upper sort of at the decision-making powers within the treatment team. So the judges, probation officers, court coordinators. We have been able to talk to some of the treatment staff, case manager, public defender. So I'm trying to increase representation, but really it's our ability to work with their schedule and their willingness to participate. Education, most have a bachelor's degree or a professional degree. We do have a lot of experience within participants we've talked to. So most have over 7 years of experience in drug courts generally, and most have over 6 years in that specific drug court. We do ask if they know anyone outside of their professional role who has a substance use disorder or who has known someone who has overdosed. Out of the 39 people that we've talked to, only 3 have said that they don't know someone personally with a substance use disorder. And we also see that the majority also say that they know someone personally who has experienced an overdose. We're trying to figure out how to work this as well into our analysis while protecting confidentiality, because we do ask about their motivation for working in this line, working in drug courts, and their sort of perceptions. And we think that could be a really interesting component to add, how their sort of personal experience plays a role in their professional decisions. So some preliminary, sorry.
On the previous slide, I think that's a really important point. And do you know if the answers to these questions, does this distribution look similar in other courts? So like in eviction court, would it be the case that the same rate of knowing someone with a substance use disorder is seen in eviction court or seen in a federal court?
That's a good question. Yeah,
Because that would speak to maybe drug courts are selecting on the workers.
Yeah.
Right, and there are folks who have seen this firsthand more so. So I don't know if there's existing studies that could tell you that, but
we haven't looked at that. Yeah, Aditi's taking it. I told her to take notes. So yeah, thank you for that. Yeah, I think that's a really important point. Yeah. Are they drawn to this, or is it just maybe, being here in Ohio, are we more likely just the impact that we've seen due to the crisis? Yeah.
So you do know, though, if so there are judges who are elected, right?
Yes.
As well as the civil servants who are appointed. Do you know who hired the civil servants? Like, do judges stay? I don't know the process. Do judges, are they involved in the determination of who staffs their courts?
So for the drug court staff particularly, I got the sense, but I don't know, Dee Dee or Lydia, if that came up in the,
I remember some of them talking about it, I think, like when they started their drug court, like, oh, and then we hired this person and this person and this person. So I think so. I think the judges usually have to say it.
yeah, the other staff members. And judges, some of them were sort of voluntold, you're gonna do a drug court. Others were like, I'm gonna do this. Like, they actually wanted to start it. So it is interesting. Some, really, this was like a personal project, and others were just kind of inherited it. Yeah. So moving into some of the preliminary findings, again, this is a work in progress, but we're going to talk a little bit about perceptions of differences, according to participants, some sources that they've identified, and addressing differences. So we're as going through our coding and the themes, we've identified institutional, procedural, as well as community level sources of these differences. So when talking to them, what might your thoughts on these differences or potential differences, and we're asking more broadly, so we don't come in and say your court looks like this, what's causing that. But some, when they're talking about court, they feel like the processes are pretty fair. They feel like people are treated the same among some individuals. If they do think that there are some differences happening, that's not our court. So the second quote really speaks to that. I feel like other counties in Ohio are still stuck in the past. I feel like we're more progressive than any other court in Ohio. So a very bold statement, but.
Is this about differences in treatment of people of different races?
Yes.
Okay, cool.
Yeah, totally. Some acknowledge that there are differences within the court. So this individual said, there would be disparities because that's the way the system is. So it's just the way we're operating within this larger court system. And that's just, it comes with it as being part of this larger, broader court system. Another individual talked about, they didn't have the data, but they observed. And they said, at any given moment, if all my guys in there are at one time, I bet you 90% of them are white. Do I have data that proves that? No. Could I get it? Yeah. But I just observe it. So really stating, reflecting on that, yeah, and thinking about it, now that I think about it, yeah, I think the majority of them are white. Yeah.
So is this talking about the differences of who gets diverted into the court, or is it treatment once they're actually in the process of being adjudicated or moving through the court?
Thanks for that question. Yeah, that's perceptions of who gets admitted into the court.
Okay.
Yes, yeah, so who actually gets to enter into the drug treatment court.
Okay.
Thanks for these are really helpful because we're still working through this and analysis and in the paper. So, yeah, Kate.
How does one get admitted or not admitted into drug court? Like, does a judge decide that at a lower level?
Yeah, the referral
I
process.
have no idea.
Yeah, it can happen in many different ways, and we do touch on that in one of the procedural differences. So I will, and if I haven't answered that, let me know, and I can go into more detail. Okay. So some of the sources of these sort of differences in admittance, so why individuals may or may not be admitted into the court. Institutional mistrust, so that emerged, and these, saying that these disparities are going to exist because it's a culture being tied to the court. It's a system let's incarcerate our way out of this. And they further said, why would a person want to be tied to a court, a system that they may not trust, for 2 years potentially? Because again, drug courts, or treatment courts can be 18 months to 2 years of commitment. This involves weekly drug testing. It involves a certain number of meetings that they attend every week. There can be other requirements related to employment, education. So it's a pretty heavy, pretty heavy push. And the thought sometimes is that this is an easy way out. It's not. It's a very intensive process.
Is there a self-selection? Like, could people self-select to not go through this or to go through this? So, like, if there's a lot of mistrust of judges in these courts, maybe people opt out.
Yes, so some people may not want to enter. Yeah, okay. that was a source. So there may be individuals that are eligible, but they may just be like, no, I don't want to participate. Yes.
Okay. So that's kind of what you're picking up here.
Yeah.
And not just differences by race in that, perhaps.
Yeah, that could expand across. Yep. Yeah.
I'm just curious, like whether there has been any kind of research looking at administrative data at the state level to see how much disparity there is actually in the outcomes. I'm just curious about that. I know that, you know, for your project you're looking at Franklin County, but I'm just curious whether there has been any other work looking at the state level.
So we want to do that to some extent. So we do have the Supreme Court data, and that's sort of what's guiding that. So we looked and looking at the statewide and you know what's been reported to the Supreme Court. There are differences in who is being admitted or participating, completing. So we do have access to that through the Supreme Court.
Yeah.
Yeah, and that's something that we're looking at. That's another sort of planned analysis. Yeah.
Yeah. I think it would be interesting to look at whether there are rural versus urban differences.
Yeah.
Yeah.
I'd build off what Stephanie was kind of taking down the path of, there is a cohort type approach to this, right? I mean, there are shared experiences of the folks.
Mm-hmm.
Is there, was some of the stakeholders were characterizing, we don't know race and ethnicity for our cohort. Is there a sense that maybe some folks aren't coming in because they don't, because they're sensing that there's a culture that there is a disparity? So,
Yes. Yeah. I think.
Is it well known of the race for a potential entrant, and therefore they're choosing to not enter?
Mm-hmm. Mm-hmm.
Yes, yeah, we actually, so that's in the community level, we kind of touch on that. So that's more sort of like stigma that may be associated. They may not trust systems. There may be stigma towards seeking, you know, help for mental health or substance use. So yeah, that can definitely guide, I think, some of those willingness to participate. Yeah. Again, kind of related to that, some individuals have been through the system multiple times. We actually got to observe this in one of our observations. There was a participant that was just very, did not seem to trust, it was very suspicious of the court, and we talked later to the treatment team, and they mentioned, you know, the history that that individual had, and that they took a chance kind of letting them in, but they weren't sure if that was going to be a good fit, just because they weren't sure if they were going to be able to overcome, because they were an older individual and also had went through during, you know, the height of the 80s and the 90s. So there was a lot of institutional mistrust. So I think that can be really difficult, and especially if it's a judge that they've been before, and the judge has sentenced them maybe to a prison sentence, but now they're coming back and they're saying, all right, I want to give you some treatment and link you to services. They may not trust that individual. Some other institutional sources. It was identified that these sources of these differences or disparities may occur outside of the drug court system itself. So it may actually occur at the front end. So the charging end, the policing decisions, what communities get to police, what sort of offenses individuals are looking at. It can also be other stakeholders, even within the court system. So the prosecutor may not be on board with treatment courts. So they may not want to offer this as an option or be accepting or willing to accept this. Other judges can refer in as well. So other judges may not be as accepting or willing to refer participants. Even public defenders. So public defenders may not want their client to be tied to this system. They may want a quick resolution, and they may not want to offer them, or they may advise them against it. They may say, you know, I think, you know, just take the jail sentence, and you don't want to be tied to this for a few years. So procedural sources of these sort of these differences that we may see in admission. The eligibility criteria. So, and this is really for individuals to qualify. They typically have nonviolent offenses. So there are certain. It's typically maybe an felony F4, so lower degree felonies, F4, F5s, may qualify in misdemeanors. So there are certain sex offenses, typically you can't participate, sometimes domestic violence charges. If it is violence, a charge with violence or weapons, often, or trafficking. That is another thing that may make individuals ineligible. So this criteria may make individuals ineligible, and this participant noted that you know, participants of color may have had more contact with the system. They may have more of these charges. So this eligibility criteria may not allow individuals to participate just because they've had this, you know, previous interaction. Even if the current charge isn't violent, if they have a history of that, it may sort of impact their willingness to accept them into the program. So, and they say that, sometimes we try to take that into consideration, but sometimes they may not be willing to take a chance. One thing we've learned, I think, in these interviews is they're really trying to make sure that the program individuals succeed in the program, so they're also self-selecting. So they do want to make sure individuals have to be high risk, high need, so they have to be high risk of reoffending, and they also have to be high need of needing this treatment. So they may, within that, they have a little discretion, and they may think that, say an individual is not a fit for the program. Screening tools. There is a risk assessments are used. Yeah.
Sorry. Are the programs at capacity?
Most of them.
Do you know what capacity is?
Yeah, it varies by court. So we've been to a court that had 4 participants. We've been to a court that had over, Dee, would you say Lucas County had like close to 100, 80?
But it's going to be budget related, right? You said that the Supreme Court essentially signs off. And
budget, yeah, resources.
Do you know what capacity is?
I think that courts make a conscious decision. So some courts said that we're trying to increase our capacity. Some said, well, we used to have more participants. We used to have around 60, but we feel like 30 is a better fit. Just the amount of care and time we have, to provide to individuals. So
you said about like 1 day a week versus less frequent, right?
Yes, yeah.
Daily, I think it's short time.
Yeah, so it's really the courts can sort of set that capacity based on like their own sort of factors, yeah. So screening tools, they have risk assessments that are used. Most courts use the ORAS, which was developed years ago, and there is the acknowledgement that using these risk assessments, sort of kind of putting individuals into these buckets, it may be difficult to actually properly get a holistic view of the person. So, and this can also vary depending on the tool, how it was created, who's doing the screening. Other factors can play a role in who may qualify. Sociocultural attitudes towards treatment. So then moving into community level sources of differences. So this is, I think, goes back to Neil's point. So this is individuals feeling that stakeholders perceiving that individuals may not want to participate due to potential stigma. So it's just not acceptable maybe to talk about substance use. It's not acceptable to talk about treatment. They've talked about having events, and sometimes individuals don't want to show up. And they feel like, the stigma of attending an event, maybe one, an event hosted by the court system, and then 2, focused on substance use may make individuals not want to engage.
So, Tasha, but the counterfactual is jail, though?
Might be more socially acceptable.
Okay.
Yeah.
It can be probation as well, right?
Yeah, jail are going through more of the traditional, yeah.
But I think to your point that the cost of this drug court may be higher in terms of like time invested and the number of times you are seen associated with the court. So that could like affect your self-efficacy, like how it could affect the participants, how they view themselves.
The cost to the individual, like
Yes.
the cost that they see of going to jail for so long versus the cost of participating in this for 2 years.
Yes, yeah. Yeah, it is.
Stigma cost.
Stigma employers, working with employers.
Yeah.
Some employers are less accepting. In one region, they did actually have employers come and visit. It was like really interesting, more of a smaller court, but they actually have engagement from local community leaders and really a lot of buy-in for the court, which they were able to do because it is a smaller court, smaller area. So some interventions. We have some potential interventions for these different sort of causes. So data-driven responses. And really there was this sort of, what emerged is that this data isn't really being collected. If it is collected, it's sent to the Supreme Court, but they're not using it to guide their decision-making within the court. And as this individual says, we need to parse it down, chop it finer and finer, and get to the root of something, but we're in no position to do that because they don't harvest, mine, and analyze that data. So I think there's a real opportunity to work with courts to have better data collection systems put in place. And I think not only data collection on who's participating, maybe who's arrested, who's participating, who receives more of the traditional jail sentence, but also outcomes too. I think tracking outcomes more long-term. So for institutional sources, another, speak to the data-driven responses. There is buy-in from the Supreme Court. So the Supreme Court of Ohio has made this a priority. They're focused on this, so there is that sort of institutional buy-in, and it sounds like there could be the support to put some sort of structure in place for courts to start really measuring and capturing this. So, and this is really speaking to, they're also acknowledging, it's maybe something about the way the courts are being perceived. There's other work we might have to do to really resolve this. So for procedural causes of differences, so again, those were more of the eligibility criteria and the screening. So, and making sure that we're meeting people where they are as well within that. So that we need to make sure the processes that they experience while they're in the program are fair, meet them where they're at, and giving them, and really building trust. So I think this was one of the impetus for the other working paper that I'll be discussing, that sort of theme of trust and building that, giving them the opportunity to make choices. And then where they're being referred to for treatment as well, making sure once they're in the program that also the other agencies, institutions, systems that they're interacting with are providing culturally relevant and appropriate treatment for these individuals. So screening tools, there were recommendations on making changes to screening tools, being better able to capture some of the risk and need of individuals. So, and moving beyond just sort of the criminogenic needs. So moving to things like mental health, is where they're living safe. Who are you, is who you're spending time with safe. So finding other ways to capture within the screening tools that hasn't been there historically. And then speaking to the community level of differences, so more training and community outreach. So finding ways to get into the community, to build that sort of interaction with communities, and have them see the judge in a sort of a neutral space, I think, as well as trainings within the system. So some spoke about having their own sort of DEI, diversity, equity, inclusion training that they do internally. And that isn't specifically recovery court-based, but it was for the court system itself. So some lessons learned, or limitations, I think this is definitely very focused on Ohio. However, I think we're providing a framework. So being able to really understand admission and being able to kind of understand from an institutional, procedural, and community level factors, I think this is something that could be applied to other areas. We did have challenges discussing race. Individuals, the conversations about race could be tense. We did sort of come back, revisit language, and revisit that multiple times. And we had to make some study adaptations. So we did change those questions, and we also had to respond to the 2025 executive orders. Some preliminary conclusions, we do see these different factors, institutional factors such as differences in law enforcement and legal representation, procedural factors such as eligibility and screening tools, and those community level factors related to perceptions of treatment contribute to unequal drug court access. So participants really emphasize the need for training for stakeholders and increased community outreach to build trust. And that ties in well to the next working paper. This is much less developed, so this will be a much quicker walkthrough. But I think this builds in well with that sort of how do we build trust? So this sort of procedural fairness, what does that look like within courts? So just a brief overview of procedural fairness. So this is the extent to which the processes and procedures taken by governing authorities are perceived as just and fair. So it's more focused on the processes and versus the outcome. So you may disagree with the outcome, but are the processes that led to that outcome, do you perceive those as being fair and just? And we're analyzing we've been focusing more on the observation data for this for now. I think we're going to build in the interview data as well. But we're really looking at this through the 4 principles of procedural fairness. So does the participant feel like they have a say, or are they actively involved? Is there neutrality in the decision making? Is it sort of impartial? Is everyone treated the same way? The sort of respectful treatment. So how are participants talked to? Do they maintain that sort of dignity throughout the process? And then trustworthy authorities. Do they actually trust the individuals making these decisions for them? So treatment courts are generally viewed as more procedurally fair than the typical court proceedings. And this procedural justice are largely the perceptions of that are largely a result of the judge-participant interactions. So how, because the judge is the overall figurehead of the court. So when individuals think about drug court, they're going to think about that judge that's been overseeing, because the judge ultimately has the final say on sanctions and also the ultimate say on any incentives that are provided. And this can vary across different actors working in drug courts, and the community perceptions of procedural justice towards drug court participants are consistently high. Some gaps in existing literature. There's few qualitative studies exploring the mechanisms of drug court and why they work. And we also have limited research, especially in the procedural fairness space, analyzing multiple drug courts across different geographic classifications, so rural versus metropolitan, for example. So again, just a reminder of where we've been. We've visited 16 courts, 11 counties, 59 hours of observation. That doesn't count car time, I don't think, and 39 interviews. So the counties in yellow are those that we have planned observations, and I think we have something scheduled in the next few weeks or months. So this is kind of a way for us to get feedback as we're going through it and starting our initial analysis. And we're thinking of how we can capture these principles and what we've observed. So just to kind of explain the drug courts and how they vary, the court sessions location can vary. So some sessions are held within the courtroom. There were a few that were held outside of the courtroom in more informal, neutral settings. The length of time with participants, so sort of to measure voice. So does how the session is structured, is that something that promotes the individuals to talk, to have their voice in what's happening? Where does the judge preside, and where do participants sit? So that sort of power dynamic. We did see some judges sit, they're on the bench, and the individuals are either sitting in the rows, or they're sitting in the jury seat. Some judges sit down at the prosecutor's area. The individual comes and sits across from them. So there's variation. Sometimes there's a circle, and they just sit in a circle. It feels more like a therapy, sort of a group therapy session. And then who does the judge talk to? Do they speak to the participant directly, or is there an attorney present? Do they talk to that attorney? Neutrality. So kind of thinking about neutrality, how can we measure that? Do participants talk for an equal amount of time? Do treatment team members seem to talk about each equally? Because there is a check-in with the treatment team. So they'll say, talk to the participant, how are you doing? They'll check in with their treatment team. So who's present on the treatment team? How much do they talk? And are sanctions and incentives provided equally? So again, they can provide sanctions if participants break some of the requirements that they have, or they can provide incentives. So these are things like they have drawings. When court has a fishbowl, they go in and if they met all their things for the week, they can draw out and get a gift card or something, just to sort of incentivize that treatment. Is that provided equally? Respectful treatment, just that sort of dignity. Are food and drinks provided? What does this session sort of look like? Do courts engage in that contingency management? So do they provide an opportunity for incentives? What sort of activities are held? So some actually structure and have participants answer questions. They have them reflect. They'll read something, and they have each person reflect on this sort of quote that is read. Are personal details and sanctions publicized? So some courts say if an individual will have a sanction, they'll say, let's talk about this after, see me after. Some kind of air everything out in front. So how does that feel for that sort of respectful treatment? And then trustworthy authorities. Is the judge in the robes sitting behind the bench? Some judges have their robes on, they're unzipped. Some don't have robes, they're in professional wear. How does that change that sort of trustworthy, those perceptions of that individual being trustworthy? Does the participants take an oath? What do those sort of processes look like? And then, is there an online presence? And looking at these courts, does this seem like legitimate? Like if you go, can you find something about these courts online? So these are some areas that we're thinking of to capture this. We're definitely still in the process. Like I said, this is an early stage.
I thought you meant you were going somewhere else with online. Can folks zoom in?
Yes, that's another good thing. Yeah, Aditi, if you can add that. Yes, there are individuals that may be located in a treatment center outside of, yeah, and they will have the opportunity to zoom in, yes.
So all of the individuals that are involved in a treatment court are present. So all of the people that are being treated are together at once?
Yes,
okay,
yeah.
At any given point in time?
Typically,
it's
yeah.
It's probably flows. You're not always with the same people because some people graduate, some people come in?
Yes, yeah. Well, they typically have it's by phases. So they'll have phase one meets this week. So some individuals may get through phase one a little faster. And they may go into phase two, but typically they have it broken down by the phase that the individual is in. Yeah.
It's cohort, right? The phase is cohort.
It is. Some individuals may be in a phase longer than than others, but they'll move through, yeah.
Tasha, I'm just curious whether you can sort of observe interactions between the judges and the people who are in the present, and whether you can look at the interactions repeatedly, because then you'll have sort of some ideas about, over time, how the relationship builds, right? I mean, like, for example, I'm looking at your voice. I mean, those are sort of structural factors that may influence voice opportunity, but actually whether they engage in voice, right?
Two participants,
Yeah, and what does it look like? Because there is a clear power difference, right?
Yeah.
Yeah, I mean, I'm really fascinated by a lot of the things you're talking about, but I wanted to kind of build on what you were just saying, Russell, because it seems to me that it seems like you're positing that, and I think rightly, that procedural fairness is kind of a theoretical lens through which to kind of understand kind of what's happening in the courtroom context. And so one of the things that I was sort of wondering is about the groups, your sort of, whether or not you've tried to kind of conceptualize these individual tenets of procedural fairness in a way that your research could challenge them, could extend them. Yeah, I mean, because I agree with what Russell was just saying about those kinds of structural factors, but I think it would be useful to offer some kind of like conceptual view, and I'm sure you will in the paper and that kind of thing, but I was just kind of thinking about across all of those different categories, especially given that it's going to be a qualitative study.
Yeah.
I think that there's a real opportunity to challenge, I know a little bit about procedural fairness, not nearly as much as you all, but to really kind of challenge some of like what existing research has indicated about the nature of procedural fairness, because when you go and review your observations, I imagine that it would raise a number of questions across a number of these kinds of dimensions of procedural fairness.
Yeah, thanks for that. That's definitely, we hope to be able to expand on that sort of procedure, what's been done in the procedural fairness space related to drug courts, and really, using this as sort of an initial framework, but how can we add to this, these sort of elements, like what's not being captured, yeah.
The other thought that I was having, that like if you actually observe the interactions, then you can perhaps code, like, during that interaction, whether the judge is interrupting the other person when the other person is talking, how much time the judge is giving, like the respectful treatment. I mean, very rarely people would yell or say something terrible. There's those nuanced interactions would give you really rich data about who has high social status essentially within that space versus who doesn't, right?
Yeah, I was thinking about like tone,
Yeah.
subtle things like eye contact,
Yeah.
Could be something, so yeah.
Yeah, we are almost at time, so I just want to say we're missing some perceptions of key stakeholders, so the participants themselves. So I think this could be used as well as a framework to really expand. And, these are our perceptions. So I may see a judge as trustworthy who has their robe, who's not wearing their robe, but maybe the participant would say, I feel like they're more trustworthy if they have their robe. Next steps in the short term, finish all of our interviews and observations. We do have a multi-phase dissemination plan, so focus on providing this feedback back to each court. I do want to call out, Lydia has been putting together these reports for the court, so really she's put on her graphic designer hat. For this, we're going to provide a report back to each of the court we visited. So the first 2 pages will be more general information, and then we'll have some specific information to each court. So looking at about 3 to 5 pages for each court.
Did they ask for that, or did you just volunteer it? It's awesome that you're doing that.
Yeah, that's something that we built in. We wanted to have immediate feedback, as well as we're also doing a webinar. So we're in webinar development. So we want to have this immediate feedback to stakeholders. We're working with DPC for that.
So cool.
Next steps in the long term, building sort of a larger research collaborative, the Spark Ohio project. So we see other projects falling under this with Russell, Vic, my colleague in the GRC, Crystal Gisone. So really building and using our relationships that we've developed with these other stakeholders here in Ohio. So thank you. I didn't get to the questions, but please provide any feedback. These, again, are very early working papers, and it's been really helpful to hear this feedback. And I think kind of thinking through how we're talking about some of this and introducing it, this has been really helpful. So thank you all.